Wonderful. Okay, so next slide, please. Oh, right. So Compassionate Choices, we are the nation's oldest and largest and most active nonprofit working to improve care, expand options, and empower everyone to chart their own end-of-life journey. We believe in patient-centered care, where the person is in charge of making their own healthcare decisions. Also, that people should be fully informed and supported by their healthcare providers on a full range of end-of-life options. Next slide, please. Okay, so we're just gonna take a quick moment before we dive in to celebrate. Woo! I am so incredibly excited for all the Coloradans. We did it, y'all, for those folks who are on here that helped make sure that they were there to testify in person or provide written testimony, or our wonderful, very fierce advocates and volunteers that went out, did lots of community presentations. Thank you, thank you, thank you. We wouldn't have done this with everybody's support and help. And I am so appreciative of every single one of you. And I am so excited that we did it in Colorado. And now the governor signed SB 24068. It is going to be coming, it's going to be coming into effect on August 7th. So we are coming up on that time frame. But I just wanted to share with you all so we can all just do a clap together that we did it, Colorado, we did it. And all right. Oh, there's a few more people I'm just gonna admit here. Okay. All right, so on to the next slide, please. And then my coworker Ashley's gonna take it over.
Yes, so let's start things off by defining medical aid in dying. Medical aid in dying is one end-of-life option that someone may choose to seek. It refers to a clinical practice in which a mentally capable, a terminally ill adult may request a prescription from their healthcare provider for medication that they can choose to ingest to die peacefully. This is a multi-step process. There are strict eligibility criteria and other safeguards embedded in medical aid in dying and within the laws to ensure that everyone pursuing the option is protected. Remember that medical aid in dying is an option for qualified, terminally ill individuals. It does not cause more people to die, but it helps people to die in a way that's acceptable to them. Next slide. Let's take a look at this map of the United States. You'll notice there's some different colors on this map. Medical aid in dying is authorized currently in 11 states and jurisdictions, including Washington, D.C. 19 states have actually introduced legislation this year to authorize medical aid in dying. And some of those states, they're still in play. We still may see some action there. So you'll notice the dark blue states is where medical aid in dying is currently authorized. The light blue states is where legislation was introduced this year. Please note that in Washington State and Oregon, both of these states have removed their residency requirements. So we like to highlight that for folks who may not live in Colorado or may live in a state where aid in dying is not legal, that these two states do authorize patients to access aid in dying, and they do not have to prove that they live within those states. Next slide. Eligibility requirements are going to look pretty uniform across the United States. We're going to talk specifically about Colorado here. So in order to qualify for consideration to get a prescription for aid in dying, an individual must be a resident of Colorado. I need to highlight this because there were a few newspaper articles that came out this week that unfortunately provided misinformation on this topic. So for your knowledge moving forward, you must be a Colorado resident in order to obtain aid in dying even after August 7th. A person must be an adult aged 18 years or older. They must be terminally ill and determined to have a prognosis of 6 months or less to live. The person must be capable of making their own medical decisions. And they must have the ability to self-ingest medications into their own gastrointestinal tract. Note that if a patient can no longer swallow, they are allowed to use things like a feeding tube or a rectal catheter, as long as they are still able to push a plunger and administer medications themselves. Next slide. Some other requirements include, click or hit next. Thank you. Okay. The patient must make 2 verbal requests, a minimum of 7 days apart, and 1 written request. That written request can be found on the CNC website if you're looking for the actual form. The Colorado Department of Public Health also has this. It's important to ask a healthcare provider to make sure that these requests are documented in a medical record. So this is a change to be aware of. Previously in Colorado, there was a 15-day waiting period. As of August 7th, please know that that waiting period has been reduced down to 7 days. 2 healthcare providers must confirm the patient's eligibility, and the attending provider must inform the person about other end-of-life options for care. So that can include things like hospice and palliative care or continuing aggressive treatment. Next. Oh boy. This is interesting. I'm going to continue. 2 witnesses must sign a written request form as well. Those witnesses must attest to the voluntary nature of a individual's request. So please be aware that those 2 witnesses, at least one of them cannot be related to the individual by blood, marriage, civil union, or adoption. At least one individual must not be entitled to any portion of the person's estate upon his or her death, like an heir that's documented in a will. A witness can also not be an owner, operator, or employee of a healthcare facility where the individual is receiving healthcare or treatment. And neither of the individuals attending, a physician or an APRN, a nurse practitioner, are going to be allowed to authorize. And that also includes medical durable power of attorney as well. Okay, stay on this slide for a minute. The law provides additional protections as well. Accessing medical aid in dying does not adversely affect a person's will or insurance. This is a question I'm most frequently asked by patients. They're concerned about what is going to happen with their life insurance policies. So the law specifically mandates that wills, insurance contracts, and annuities are not affected if a qualified individual utilizes aid in dying. Another frequent question I'm asked is regarding death certificates. So please be aware that death certificates must list the underlying cause of disease as the cause of death. It is not going to state anywhere on that death certificate in Colorado that the patient utilized aid in dying. And then just be mindful that equating medical aid in dying with suicide is incorrect. Even per the law, it is not considered suicide. And it does a disservice to those people who are trying to access this option, as well as those impacted by suicide. Next slide. You'll click next. Thank you. Please remember that there are multiple steps in order to complete a request for aid in dying. To ensure that it's a smooth process, we recommend that individuals talk to their healthcare providers early about medical aid in dying medication and begin that multi-step process if they're interested, because it really takes time. Be mindful that within the process, once an individual has secured their supportive physicians or nurse practitioners, they should help the individual get through the rest of the process. So your main healthcare provider may refer an individual to a secondary healthcare provider to confirm eligibility. Let's look at the general overview of the process. The attending is going to confirm that the patient is eligible for aid in dying. So it's important that we make sure that the attending is willing and able to serve in this process. The patient would provide that initial verbal request to the attending and undergo an evaluation with their provider. The patient will then receive an evaluation by a second provider to confirm, And then the patient must make a second verbal request to the main healthcare provider, separated by a minimum of 7 days as of August 7th. In the meantime, please be aware that it is still a 15-day waiting period until August 7th. Remember that individuals need to complete a written request as well, and that can be submitted to that doctor within, or APRN, within the waiting period. And that the attending as of August 7th will be allowed to waive the mandatory waiting period if the patient is unlikely to survive the next 48 hours and if they meet all other qualifications. So this is a very general overview of a process that actually takes some time, largely in securing resources like the participating providers and finding witnesses. So once an individual has made a second oral request, it generally takes about 7 to 10 days to fill a prescription at a specialty compounding pharmacy. But it can take less time. It just really depends on what the healthcare system or the hospice for patients receiving care and the resources they have access to. So if your healthcare provider doesn't know where to send a prescription, again, please know that we have a resource called Doc to Doc. We are a group of healthcare professionals supporting other healthcare professionals, and we'll give you some more information about Doc to Doc later in this presentation. But if you need assistance in finding a pharmacy, or learning more about potential participating providers in Colorado, please reach out to our Doc to Doc line. Next slide. The absolute most important thing that anyone can do regarding any of their healthcare options, their desires for care and wishes for care at end of life, is to talk to their healthcare provider and their healthcare team. Specific to aid in dying, individuals will need to find a healthcare provider who is willing and able to support them through the whole process and to write the prescription if they qualify. Sometimes this can be very difficult depending on where an individual receives care. When an individual talks to their healthcare provider, it's very important that they be clear about the request and ask the provider to write down the request in their records. I've heard from patients who thought that their healthcare provider was on board and was going to actually serve as an attending provider and write a prescription for them when the time came. However, ultimately, the physician chose not to support them. Remember, you don't have to be sick to ask your clinical team, your providers, if they would support you in this option if you became terminally ill. So it's better to find out as soon as possible how they will provide care in that aid in dying process. If having this option is important to you, ask them, would you be willing to write a prescription for medical aid in dying if I become terminally ill and qualify? Next slide. There are several reasons why healthcare providers sometimes do not support their patients in the option of medical aid in dying. And so it's important to find out why. One is your healthcare provider allowed to prescribe? Be aware that Catholic health systems, such as Common Spirit here in Colorado, they do not allow their medical providers to practice medical aid in dying, even if the provider wants to. If you're in a secular system that does not allow medical providers to prescribe and you need information about other provider options, please reach out to us. We encourage all healthcare systems and hospices to have a neutral or supportive policy that allows medical providers to support patients in their options as they are seeking aid in dying. If your healthcare provider absolutely refuses to participate in the process, ask them to refer you to another physician or nurse practitioner who will support you. We encourage objectivity in medicine and healthcare professionals. We should not abandon our patients or make them feel ashamed for asking about end-of-life options. If this is what an individual wants, ideally, your providers should help you find someone who will support you throughout that process. And then if you would please click, Marina. Something else to consider is that it's quite possible that a medical provider may not know much about medical aid in dying, which is something that we at Compassion and Choices are trying to change. So if you think your medical provider might support you, but they're saying they just want to talk more about that option with another healthcare professional, please share our free consultation service information with your providers. Here's the number here. It's listed on the screen. This is for our doc-to-doc line, and healthcare professionals can reach out to our team of other healthcare professionals to provide provider-to-provider support. Our providers that are on staff, many of them have actually prescribed medical aid in dying, and so they can walk an individual through this process. Finally, we also have an amazing service called End-of-Life Consultation Service. This is actually for patients that want to talk through all end-of-life options. It has the same phone number. Just call. You can leave a message and someone would call back, usually within about 24 to 48 hours, to answer any questions that a patient or healthcare professional may have. Next slide.
All right, thank you, Ashley. So now we are going to dive into the numbers. So the numbers of Coloradans who have accessed this law. Next slide, please. Okay, so here you are seeing the data from 2023, so last year. So last year there were 389 patients who were prescribed aid in dying medication. And then you can also see the number 294. So there was 294 patients that received aid in dying medication. So it was dispensed to them. So as you can see, the numbers are different, and this could be multiple reasons. It could either mean the person lost capacity to self-ingest, the individual decided to change their mind, or the individual died while waiting. So that is why there is a little bit of a difference between the prescription of aid in dying medication and the dispense of aid in dying medication. Next slide, please. So the last 6 years, the number of patients that were prescribed aid in dying medication, it was 1,476. And again, a little bit of a different number here for the number of patients whom aid in dying medication was dispensed. It was 1,134. And I did just want to mention that the underlying terminal illness or condition among the patients that were prescribed aid in dying medication were, of the 1,476, 891 were individuals with cancers, a wide variety of cancers. Pancreatic cancer was the number one. And then also 243 of the 1,476 had a progressive neurological or neurodegenerative disorder, such as ALS. So I just wanted to specify that because that is also a frequent question that I get, who is accessing this law. Next slide, please. Okay, so let's talk about the original law and then the improvements to the Colorado End-of-Life Option Act. So Senate Bill SB 24068, it was authored by Senator Janal and also Representative Brown. It was signed by Governor Polis on June 5th of this year. And like we said several times, the law is going to go into effect on August 7th. And it does maintain the End-of-Life Option Act's core eligibility requirements. Next slide, please. All right, so just a little bit of history. So it was a citizen initiative balloted measure. In 2016, it was called Proposition 106. It passed with an overwhelming voter support. 65% of Coloradans voted yes for this. And it went into effect in December of 2016. Next slide, please. And Ashley spoke previously about this, but the original Colorado law that is still happening, it's right now until it changes on August 7th. It requires that 2 physicians certify the terminal illness and prognosis of 6 months or less to live. There is 2 verbal requests to attending physician separated by a minimum of 15 days. And there's also a written request witnessed by 2 individuals. Next slide, please. Okay, and Ashley also spoke a little bit about this as well, but the changes now to the Colorado law that is going to go into effect on August 7th, instead of just being physicians, this law has now increased its access to include advanced practice registered nurses, also known as nurse practitioners, to certify the terminal illness and prognosis of 6 months or less to live. Also, the two verbal request is, again, either by a physician or an advanced practice registered nurse, separated by 7 days instead of the original 15. And then also there is the waiting period can be waived if the prognosis is, if the medical provider, the physician, or the advanced practice registered nurse deems that the patient's prognosis is imminent death and they are not going to, they assume that the individual is not going to live past the 48 hours, then it can be waived. Okay, next slide, please. And then I also just wanted to share, and I don't know if folks have seen this or heard me say this before, but Denver Health provided some stats that in Colorado, 1 in 4 patients died while waiting. And this is particularly for individuals who utilize aid in dying medication through Denver Health, through their medical aid in dying program. But that was a very important statistic that we were able to receive from Denver Health, particularly Katie Sue. She is phenomenal for those folks who know her. And this is a stat that was really important sharing with legislators this legislative session, because it is a very large number of folks who did die while waiting. Next slide, please. So start talking. It is super important to start the process of medical aid in dying before you were even diagnosed with a terminal illness. And Ashley spoke about this a little bit previously. Ask your physician, ask your healthcare provider, ask your advanced practice registered nurse, whoever that may be. Are you willing or able to, if I become terminally ill, to provide aid in dying medication? If this is an option I choose to move forward with. It is just really important to start those conversations now, because a lot of times when the individual waits, you know, you've already gone through a plethora of appointments. It's a very overwhelming time when you're diagnosed with a terminal illness. There's a lot of thoughts going through your head, and depending on what the prognosis is, if it is imminent, I mean, this is a process to still access aid in dying medication. I'm grateful that we were able to open it up so we can allow more individuals to have access to this. But regardless, it is a little bit of a process, and you don't want to wait until last minute. You definitely want to be able to have those conversations as soon as you possibly can before you even get diagnosed with a terminal illness. So if your provider is not somebody who is willing to provide that prescription, you would be able to then find somebody who can. Next slide, please. Okay, so the improvement bill is going to go into law in a few months. So what is next? Next slide, please. There are going to be 3 main components of the Access campaign. There is structural outreach, medical outreach, and also public outreach. Next slide, please. So right here, I just did a snapshot of the Colorado Department of Public Health and Environment. They have a really great website link that specifies all things medical aid in dying. So it is generally up to the state's Department of Health to implement and coordinate the paperwork that medical providers have to turn in. And I can share that I have already been in touch with the manager of the Vital Stats program of the Colorado Department of Public Health and Environment. And since medical aid in dying has been a law in Colorado since 2016, the changes of adding advanced practice registered nurses as healthcare providers who can now prescribe aid in dying medication is going to be pretty straightforward. So there shouldn't be anything additional or extra, I guess I could say, that is going to slow down anything with the Colorado Department of Public Health. Next slide, please. Okay, also working with healthcare systems and hospices. So Ashley, as she kind of previously spoke about, and Ashley is part of our clinical engagement team. We have medical outreach team, clinical engagement, that offers free technical advice and policies tailored around the state's unique laws and work with healthcare systems and hospices on their policies. And we also offer free clinical consultations by experienced healthcare providers. And like Ashley previously said, we do have healthcare providers who have gone through that process in prescribing aid and dying medication. And we also offer peer-to-peer webinars and in-services. And this picture that you see right here, this is from last year's End of Life Symposium of City of Hope that puts on, that we also help organize to continue educating medical providers on end of life options, including medical aid and dying. Next slide, please. Okay, so this is something that everyone can help out with, is helping us collect and influence health system and hospice policies. And I just put these two down here. I'm sure that there's more. A lot of healthcare systems and hospices are neutral. These two are in support. Bristol Hospice, I just previously had a meeting with them several weeks ago, and I'm going to be working with them on a webinar for medical aid and dying in a few weeks. And then also Denver Health, they have a really wonderful medical aid and dying program that Katie Sue, the individual that I spoke about earlier, is the lead of that program in Denver Health as a clinical social worker. Next slide, please. And then I believe Ashley's taking it over again.
Thank you so much, Gina. This is our clinical engagement and education team, those of us that are active clinicians. Our team travels the country. We provide virtual education to mentor and train physicians, advanced practice providers, nurses, social workers, and death doulas in the clinical practice of medical aid and dying. So once physicians and other authorized providers become experienced with medical aid and dying, we support them in further mentoring and training to other local providers. The goal is to help more healthcare professionals feel comfortable supporting eligible patients in this option. Medical aid and dying is a clinical practice and part of the continuum of care. So there's no special certification needed in order to participate in this process. Next slide. As I mentioned earlier, we have a free confidential consultation service for providers and other types of healthcare professionals who have questions about any end-of-life option, including medical aid and dying. Medical providers have the capability to follow the steps to support a patient in their request for aid and dying, but it's nice to have someone to talk to about it informally in a safe and confidential way. So we encourage our volunteers and supporters to share this resource with their doctors and their healthcare teams. Our number's down here. It's 1-800-247-7421. This is our doc-to-doc line, and you can also learn more at our website, which is listed there as well. Next slide. A couple other neat resources here in Colorado. Compassionate Choices, we have an end-of-life consultation service. This is actually available to patients nationally, but please know that Coloradans are welcome to call in as well. This is really for patients, and it provides confidential, non-judgmental professional support around end-of-life planning, no matter where they live. Also want to elevate End of Life Options Colorado. It's our incredible 501c3 here. It's a statewide, a nonprofit organization that provides education and support to anyone who wants to learn about their end-of-life options. They work with individuals, families, community organizations, and medical providers to help them understand the process and laws and how to find resources. Next slide. Okay, Gina, you're up.
Thanks, Ashley. Okay, so this is just a few photos. There are so many more that I wish I could share with you all, but let me tell you, and I said at the beginning, Colorado volunteers, you all make such a huge difference. I cannot say that enough. I am so incredibly grateful for all of you for taking time out of your busy days to advocate for end-of-life options in Colorado. And these are just a wide variety of photos of volunteers and of the legislative, either the Senate or the House hearings. I can't tell which one is which, but in these photos, but really you all make a difference. And it is so incredibly important with all of the volunteer work with, community, giving community presentations and having booths and tabling and spreading the word and sharing what's going on and just sharing the news with the updated bill that is going to be going into effect on August 7th. So thank you, volunteers. We couldn't have done this without all of you. I could just keep saying that a million times, but I truly am so appreciative. Next slide, please. Okay, so media. Media is really important for medical aid in dying. It's always important to try to stay in the headlines as much as possible. And one of those ways is sharing a story. And this is just a snippet of one of our storytellers. We have several amazing storytellers in Colorado. Again, I wish I could have like 20 slides to share each and every one of your stories, but I just had to keep it to one today. So this is just one of the storytellers, Jacob Shannon. And storytelling is really important because using the terms like medical aid in dying seems really clinical and detached, but hearing from somebody's personal story and journey on this issue makes it profound. It just makes it relatable. And it makes it really relatable for legislators as well, who are the ones that are able to change the law. So storytelling is so incredibly important. So Jacob Shannon, he is a storyteller, and his mother, you can see right there holding the umbrella, her name is Linda Bluestein. So Jacob, he grew up with his parents who were passionate supporters of medical aid in dying. And as he explained to us, he said, my mom and dad prepared me my whole life for death. And it was a topic that was never taboo, which is really cool to hear. And so in July of 2023, Jacob left his home and his family in Colorado to support his mother, Linda, who was diagnosed with late-stage cancer. And he accompanied her on the challenging journey from going to, she was living in Connecticut at the moment, at that time. So she went from Connecticut to Vermont, which is about a 4.5-hour trip, terminally ill, so she could access end-of-life options. So for those of you who do not know, like Linda's full story is she, alongside of Compassion and Choices, we were able to sue the state of Vermont to allow non-residents of the state to use medical aid in dying. And Linda was the first individual to be able to cross the border from Connecticut to Vermont to utilize aid in dying. And she was able to utilize aid in dying. And from what Jacob shared, it was a beautiful ending. Family was able to be there with her. So I am so incredibly grateful to have storytellers who are able to share this and really spread the word about what this means to them and how important it is to keep sharing their story with everybody in the community and all of the legislators as well. And it's also good to know volunteers who are out there doing community presentations and tabling and doing all the amazing things that you all do for us. Is with all the conversations that you're having, if anybody ever shares a story with you and you think in your mind, like, this would be a really good story, please send them back to me, or I guess I'd say me or somebody else at Compassion Choices, but please pick me because then I can get them directed to the right person. But we want to make sure that we can lift up their voice and their story and then share it with others. So just something to always have in the back of your head, because sharing a story is so incredibly important. Next slide, please. Thank you. Okay, our very own Ashley Fry. So another really important thing in the media is for opinion articles or op-eds. just to kind of share highlights and have your own voice heard. So this is a highlight that Ashley shared, focuses on the barriers of Colorado and the End of Life Option Act. And Ashley Fry, she is, for those of you who do not know, she is a board certified acute care nurse practitioner. And she is just a wealth of knowledge and a force. Let me tell you, I am so incredibly grateful to have her as a colleague, but she has done amazing work in Colorado. And I'm always grateful for her sharing her opinion and her expertise. So op-eds, it's very important. Okay, next slide, please. Thank you. So every single state at Compassion Choices, every state has their own website at Compassion and Choices. So you can just go to compassionandchoices.org and you can either scroll down a little bit. There's a map of the United States and you can click on the state of Colorado, or you could do a / Colorado and that will take you to the website as well. And there is a wealth of information and resources and tools that you will be able to see and access on that. Next slide, please. Ways to help. Oh, right. I cannot say this enough. Volunteer, like volunteering for Compassion and Choices. We need you. We need your support. We need your help. And I'm so incredibly grateful. There's only one in me, and we can all work together. And that is through the help of volunteers. So volunteering with Compassion Choices would be the first thing, and connecting us with groups or organizations that would like us to give presentations. That could either be by, with me providing a presentation, or Ashley, somebody from our clinical engagement team, providing a presentation. We are happy, more than happy, to provide presentations to any particular groups or organizations. And that being said, also connecting us with medical professionals who want to learn more about the law. Like Ashley was saying before, there are providers that just don't feel comfortable. They just don't have enough knowledge. And this could be something that you could refer that particular medical provider back to us. And there could be that peer-to-peer conversation. And that provider would be able to talk to somebody on the clinical engagement team who does have that firsthand experience. Next slide, please. Public presentations. I spoke a little bit about this. Volunteers. There are so many volunteers doing amazing presentations out there. But this could also, presentations, it could be at community and senior centers. I have a volunteer who has been very busy at local public libraries. This could be at the Rotary or Lions, like community club, city clubs, senior independent housing, elder care facilities, retirement homes, churches and places of fellowship, community radio or television segments, and also healthcare organizations. There are so many ways that we would be able to get out there and either, like I said, us give the presentations, or the volunteers would be able to do presentations as well. Just please feel free to reach out to me if you need any support, help, or guidance. I am always here to provide resources to you all. Next slide, please. And we have resources that are available on our website in several languages listed below. And there is a web accessibility that is for, just from the snapshot on the screen, we have accessibility for vision impaired, cognitive disability, a whole wide variety. So we want to make sure that our website is accessible for everyone. And that's just something that I wanted to make sure that we highlighted. I am hopeful that we will have more languages moving on, coming down, or wrong word, not coming down I don't even know what I was going with that, but essentially I want to make sure that I'm hopeful that we're going to have more languages coming down the pipeline in the near future. So stay tuned with that. And if there's any particular language that you're looking for, please let me know as well, and I can connect with our communications team to see if we'd be able to accommodate that. All right, moving on to the next slide. And Ashley.
If you don't already, please check us out on social media, through our social media, whether it's X, formerly known as Twitter, YouTube, Facebook, Instagram. This is where we post information about Compassion and Choices events, national news related to end-of-life care, new resources to learn about end-of-life care and options, and then general education as well. So please check it out, and don't forget to check out our website as well. We provide a lot of updates there too. Next slide. All right. Now it is time. We're here to answer any questions you may have. Again, ask a question, type it into the Q&A, and then just be aware as well that Gina will send an email after this with the slides and presentations spoken about after this presentation. While we're waiting for questions, I do want to highlight there was a comment in the chat regarding Denver Health's Medical Aid in Dying program. Their information is shared there in case anyone needs help or support with their medical aid in dying journey. They're an incredible resource that I really value. I live in Colorado Springs. I've taken care of a number of patients who are trying to seek aid in dying here in Colorado, and they have challenges with that. And medical aid in dying, the medical aid in dying program at Denver Health has been incredibly helpful for my patients down here in the Springs. So thank you so much for what you do.